Please note that during the COVID-19 pandemic, some of the visiting arrangements that are talked about in the virtual tour have been temporarily suspended. No siblings or extended family are allowed to visit. When visiting your baby, the nursing staff will guide you on the correct personal protective equipment or PPE that you can wear to keep you, your baby and our staff safe. We will support you to be able to effectively wash your hands and care for your baby. Welcome to the Newborn Services Managed Clinical Service, St Mary's Hospital, Manchester Foundation Trust. This tour is of NICU, the Newborn Intensive Care Unit at the Oxford Road campus. My name is Emma and I'm a junior sister working on NICU. I'm here to take you on a virtual tour of our unit. Every year we care for lots of babies that are born as premature as 23 weeks gestation and or have health problems that are picked up before and after birth. We also care for babies that have been born unexpectedly unwell. The unit is located on the second floor of the hospital. As you arrive at the unit, you must press the buzzer and will be asked who you are coming to see before entering into the unit. You will initially come to the reception area, which has our reception staff, a seating area, and a play area for siblings. The walls have stories from our former patients explaining their journey through NICU. You will be asked to sign in as soon as you enter the unit. This is so we know who is on the unit at any one time to maintain safety. We also ask you to sign out again when leaving the unit. If you are driving to and from the hospital, please just ask a member of staff and we can issue you with a free car parking permit. You will be assigned a locker and given a code. We ask you that you keep bags, coats, outdoor clothes and other belongings in here instead of bringing them into the clinical rooms. This helps to maintain infection control. As we go through the double doors, this takes us through to the clinical rooms. On our right hand side we have 3 sinks. We ask every visitor to wash their hands using the 7-step technique on entry and exit of the unit. Please remove any rings or watches. We kindly ask you to also use hand gel when you go into your baby's room, before and after you touch your baby or any of their surroundings. We have 9 rooms on the unit, totaling to 69 cots. We give 3 levels of care: intensive care, high dependency, and special care. Here we have our special care rooms, numbers 2 and 3. Special care is for babies that need the lowest level of care. Here, the babies will be establishing feeds, growing and developing after needing complex care. Our doctors and nurses may ask you if you have washed your hands on entering the rooms. Please do not be offended if they do. Here we have one of our milk kitchens. We have 2 on the unit, which have a fridge and freezer to store your milk. We encourage mummies to express breast milk where possible. If your baby is not able to breastfeed yet, breast milk is perfectly designed for your baby and gives them protection from infections and illnesses. Small and premature babies do not have a mature gut, therefore breast milk is kinder to their stomach. Here in the milk kitchen, each baby has their own tray, whether you use breast milk or formula. We will give you labels with your baby's details on, which you can write the time and date that the milk was expressed. We also give you security labels to keep your milk safe. Next to both of the milk kitchens, there are the expressing rooms. We have covered the walls in amazing breastfeeding stories from some of the families who have previously been on NICU. If you wish to express your breast milk, the nurses will help you. We will firstly show you how to hand express. This will encourage your milk supply. Once you have a good supply of milk, normally on day 3, we will then show you how to use the breast pump. We will give you all of the equipment you need to express your milk. In each expressing room, we have a water cooler and 2 breast pumps. If you wish to express in the room, please leave the other pump outside for another mummy to use. We also have a breast pump in each clinical room which you can use to express next to your baby. Moving along the corridor, we come to room 4. This is one of our high dependency rooms. High dependency is for babies who do not require intensive care, but still require complex care by our specialist nurses. The ward round in here and in special care areas is done once a day in the morning, normally between 9 and 11:30 a.m. Each room has a phone that you can ring 24 hours a day to get an update on your baby, and you can speak to the nurse caring for them. The other high dependency rooms on NICU are Room 1, which is the first clinical room on NICU, and Rooms 7, 8 and 9 to the bottom of the corridor. Further down the corridor are Rooms 5 and 6, which are the intensive care rooms. In here is where the most intensive level of care is given to the sickest babies that need critical care. They may be born very small and or may need ventilation. In these rooms, we have a ward round twice a day, once in the morning between 9 and 11:30 a.m. and again in the late evening. Occasionally, the end of the ward round may be delayed, depending on the needs of the babies. Please be patient with us. The doctors will review every baby in the room. We ask for visiting to be restricted during these hours to maintain patient confidentiality. If you would like to be present during your baby's ward round, then please ask the nurse caring for them. We encourage you to visit your baby as much as you wish to. You can visit 24 hours a day, 7 days a week. In intensive care, there can only be 2 visitors per patient at any one time. In high dependency and special care, there can be up to 3 visitors per patient. One parent or caregiver must be present at all times when your visitors are here on NICU. Extended family and friends may visit, however this must be after the ward round and only up to 9 p.m. Siblings may visit with parents and caregivers, but must be supervised at all times. Any other children under the age of 16 cannot visit. Whilst on the newborn intensive care unit, we will encourage you to be as involved in your baby's care as you wish to be, and we actively promote family integrated care or FI care. We will support you to independently care for your baby, including feeding your baby, changing their nappy, and giving their personal care. Look out for the FI care timetable, which shows daily sessions for families to learn how to care for their baby. We will also teach you about the importance of your baby's developmental care. This is where we try to make your baby's environment as like the womb as possible. We do this by using incubators to keep them warm, reducing light by using incubator covers, and dimming the lights. We try to limit noise as much as possible and encourage parents and carers to have cuddles and skin to skin as long as the baby's condition allows. Whilst your baby is in the newborn intensive care unit, we will start a FI care passport. We will help you to record your baby's progress in this and any skills that we may have taught you. For example, often babies are too small to breast or bottle feed, so they are fed through a nasogastric tube. This tube goes through their nose and down into their tummy. We can teach you how to feed your baby this way, and this will then be documented in the passport. Moving through the ward, here is the second of the expressing rooms and milk kitchens, and then here is the parent sitting room. This is a relaxed area with sofas in here for you to use. Parents and carers find this room very beneficial as it gives them an opportunity to speak to other parents and carers. It provides a good support network with people who are experiencing a similar situation. We also have 2 unit counsellors who run drop-in sessions and give one-to-one support as and when you may need it. Next is the parents' kitchen. Here there are tea and coffee facilities. There is a water cooler, a microwave and a fridge. If you wish to keep any food or drinks in here, please label them. Down this corridor, there are 5 bedrooms on the unit. These bedrooms are for parents to use on a daily basis. They are very limited, therefore priority will be given to parents and carers whose baby is very sick, for mummies who are breastfeeding, and also for parents and carers whose baby is ready for discharge. They are designed with 2 single beds and an ensuite bathroom. Both parents and carers can stay if they wish, but unfortunately, no siblings. Soon after admission, the neonatal team will discuss your baby's progress and review the next steps for your baby to go to your local neonatal unit when they no longer need intensive or specialist care. As your baby progresses and no longer needs intensive care, we will create a plan for transferring your baby to your local hospital. We will ensure we communicate with you a safe plan for transfer. Connect Northwest is the neonatal transfer service, and they will take great care of your baby if and when they need to be transferred. Our virtual tour has now come to an end. If you have any more questions or queries, we can give you a booklet on the unit, and there is lots of information on our website.